Hello, everyone, and namaste. Well, we are bringing a lot of different topics within the yoga. We know that yoga has all these acrobatic poses. I cannot do it. I know that. But back bends, that's a certain type of a flexure on the postures that yoga has. And we're going to talk with Paromita today. Paromita is one of the leading yoga instructors. She is joining me live from India. Namaste, and thank you so much, Paromita.
Paromita, it's such a pleasure to be here, and thank you for this opportunity.
Absolutely. So let's just define back bends, right? What exactly it is in yoga specifically.
So back bends, contrast to what the name is, basically means heart openness. So every pose that you do, you're lifting up your chest, you're expanding your chest, you're opening your heart. So the physical aspects is about strengthening your back, your chest, your shoulders, whereas there's also an emotional side of it. So when you're opening your heart, you're opening yourself to be courageous. At the same time, you're opening yourself to be vulnerable. So these are the various aspects which back bends cover. Multiple asanas that it does, but all of them is focused on opening your heart. So that's why, in general, the entire category is known as heart openness.
Okay, so what type of different asanas we are pertaining to, like when I do downward dog or cow, cat and cow, what are the different types? Just give us a few examples of few poses of posture.
Sure. So cat and cow that you said is a very basic back bend stretch. It's like the first warm up that you should do before you go to any complex back bend poses. Then there is the cobra pose, which is also again another basic, which is not just good for starting your back bends and for warming it up. Even if you have back pain, cobra pose is very good. And then there are the complex poses where you have the pore pose, you have camel pose. If you go to the Sanskrit names, these are like Dhanurasana, Ushtrasana. So these are different kind of poses, dances pose that you have in back bends. And then there are really complex ones, Vrishchikasana, also known as the Scorpio pose. So there are multiple asanas at multiple levels, and all of them are equally important. So a person who is doing Vrishchikasana needs to do Cobra pose first to get there.
And then let's just talk about how do back bends help? You know, we're talking about increasing flexibility, and as we age also, right? Because that is the other thing yoga helps with, longevity and aging. What does the role back bend has?
So back bend is very good for your spine health, right? Because a normal tendency is as we grow old, we tend to hunch, right? And back bend is helping you open up that posture. It is helping you strengthening your spine. Other than that, the muscles are working towards the bone, right? It helps in protecting. So when I say back bend, it makes your back strong. It's because the muscles get contracted. It's increasing the strength. It tries to keep your spine in place. So other than that, since it's a heart opener, it also works on circulation. So your circulation improves, you are energized. If you feel sleepy, if you feel lethargic, you just practice back bends for maybe 5 minutes. You will feel that, you feel better, you feel awake, you feel energized to do the rest of the activities. And back bends are also very good mood enhancers. So we suggest it to people who have stress, who are suffering from depression, anxiety, that this actually helps in relieving tension from your body.
Okay, and then maybe you could talk about a typical yoga sequence that we incorporate back bend in our sequence on a daily basis. And maybe let's just take an example of for women's health, right? We have so many problems from women point of view. So I don't know, you want to talk about the PMS part of it, or the fertility part of it, or the later stage of the perimenopause part of it, whichever phase you want to pick. Talk to me about a certain type of back bends that can help, for example, PMS, anxiety and pain, or menopause, relief of symptoms, or anything like that.
So during PMS, I would not actually suggest back bend, because back bend, for PMS, it's best to do forward bends and to do your hip stretches, not so much on inversions. So back bend is kind of an inversion. So we try to avoid that, because eventually, there are certain poses in back bend asanas where your head is lower than your shoulders. So there is an inversion here. Blood is coming to your head. So we try to avoid that if you're having PMS. But it's very like there's another pose known as bridge pose or the Setu Bandhasan, which you can extend to a back bend where you lift your hips up. That can be very helpful for women's health. That can help you strengthen the pelvic floor, as well as after pregnancy. So a year after pregnancy, or sorry, a year after delivery, we actually suggest to do yoga. We don't suggest for 1 year, let's just take rest. After that, they can do the bridge pose because that helps to strengthen the core as well as stretch the back. So, and cobra pose, definitely. Cobra pose is something which is even in a sequence. So if you talk about Surya Namaskar, which is the basic sequence, that has cobra pose in it. And you can practice that. Surya Namaskar, I suggest to everyone because it has both everything. So it has the hamstring, it has the strength of your legs, it has your shoulders, it has your chest, your heart opener, everything is included. So a sequence which anyone should practice is definitely Surya Namaskar.
And what about at a later stage of women's life when they're hitting 40s? And there's a lot of data that at least I'm reading, a lot of younger women, and when I use the word younger women, actually I should use the word middle-aged women, 40 something, they're getting perimenopause earlier, 10 years earlier than a normal age of 50 or 52 or something. So do you have some thoughts on how to help these women who are having these kind of such a stressful part, which is happening 1 decade earlier, that can affect their relationships, that can affect their all kind of things, and how can yoga help?
So yoga definitely helps in your hormone balances. So everything that you mentioned just now, stress, when a person is stressed, there's a hormone which is released in the body, which actually disrupts all the functions. So we can control the release of that stress hormone if we do yoga, definitely. If we include pranayama, meditation, all these poses, like I said, back bend is a mood enhancer. So if you practice all of these, your stress is reduced. And with that, hormones are in control. And all your symptoms, your PMS, your menopause, early menopause, it's all happening because of hormones. So yoga plays a very good role in balancing your hormones. And since I've been practicing yoga, my initial step towards yoga was physical. But after practicing it, I see its impact more on my mental and my inner health rather than just getting a lean and toned body. It's more about my inner health, my gut health, my mental stress, emotional, the way I react, all of that. It works much better if you practice yoga.
And then do you want to, can the women who are in their 40s, can they practice back bends? Because you said the PMS women, they should not practice back bends, right?
Yeah.
So now as women go into their mid-age, is it safe for them to practice back bends and incorporate it into their practice on a daily basis?
Yes, definitely. But I would suggest them to take slow. If suppose they're just starting with it, because back bend is very difficult. As I said, like normally our tendency is to bend forward. That comes easily to us. Bending backwards is difficult. So they should be very careful. And there's a clear distinction between pain and injury. Okay, a pain is something which is normal. So you have never been to the gym, and the first day you go to the gym, you are going to feel pain, and that is normal. But you don't stop there. You go the next day, slowly by slowly, your body gets accustomed. But injury is beyond that, right? Injury is not just something new. Injury is there has been a tear or there has been a fracture in your body. That is an injury. So when there is an injury, stop. If like you're doing back bend and you've pushed yourself beyond what your body is accustomed to, you may get an injury. So how I practice back bend is get into the pose, come to a point where you feel that this is your max, it is now paining, stop there. Because you need to be in a position where it doesn't pain anymore. So if you're paining at a particular point, stop there, come back to that point, and return. So you get accustomed to that. And then you take a level more. But sometimes what happens is people, because there's so much of social media, we see people doing such amazing poses. Everyone wants to do it, that we push ourselves beyond our body. We should always understand that whether you're a 40, I have seen 50-year-old, beyond 50-year-old women doing handstand. So it's nothing about age. It's just if your body permits it, go with it.
Okay, thank you so much. This particular session, we wanted to bring back bands, and we talk about women's health point of view, different big three stages of women's health, that why they should incorporate back band and why they should not. Anything else that you like to add before I wrap up the session? This is a quick 10-minute session that we bring on a daily basis to help everyone lead a holistic lifestyle.
I would just suggest everyone to not worry about getting into the asanas. I get a lot of women, especially because they are very concerned about their weight. They're very concerned. They think that they are not flexible enough, or this is something which I can never do. So just come beyond that. And yoga is something you can practice within the four walls in your house. So just get in your house, close all windows, curtains if you're insecure. Do it for yourself first. It's just for yourself. Yoga is not for everyone. Just work on yourself slowly by slowly. You will feel confident. You will want to show what you're doing, and that is really helpful. Especially, I'll talk about women, because men mostly we see they go to gym, they work out, or they don't. Right? They're either okay getting fat, or they'll go to gym. But women, we don't focus a lot on our health. We are just concerned about everyone else, seeing everything is going fine. We don't get time for ourselves. But just take 30 minutes for yourself, even if the 30 minutes will be very rewarding if you practice yoga.
Well, thank you so much. I think that makes a lot of sense. And I just want to add that yoga has so much research out there now, if you go in PubMed and all kind of science journals, and proving the efficacy of almost any health concern. Today we're talking only on back bends, but any health concerns that you can type in yoga for, and you will get efficacy, that how it helps. So take yoga, incorporate that into your daily life, if possible, even for 5-10 minutes or a few minutes on a daily basis. With that, thank you so much. Thank you, Paromita, for joining me. Everyone else, keep supporting us. We're coming up with women's programs, specifically women's program, because I feel very passionate about women's program. You can see why. And we want to incorporate those and offer it to all the women out there. Thank you. Bye-bye.
Thank you. Bye-bye.